Welcome, everybody. There should be people entering the webinar as we speak. I can see the numbers going up and people entering the chat room as well. So welcome. It's the 10th of February, 2 o'clock GMT, and you're joining a Midwives in Focus session. And it's a really exciting one because this is the first one to really focus on midwives and a Nursing Now Challenge Global Solutions Initiative focused on midwifery challenges specifically. So I'll just wait another couple of minutes as people come into the room, find their place, grab a drink, grab a seat. Good morning, good evening, good afternoon to everybody. Hello and welcome. I can see we've got already 20 odd people in the chat room, but we're waiting for a few more, so I'll leave it a couple more minutes. We're really grateful to everyone that comes along to these because it's people power after all, midwife power, people power coming together in these global solutions. So please do put in the chat who you are, where you're from. We love the fact that these are so diverse, these sessions. We have people from all over the world coming in, from all types of backgrounds, practicing in different areas in different ways. All valuable discussion, valuable to share. Welcome everyone that's coming in to the session. We're recording today. Hopefully that came up as an alert for you. And we've got some amazing experts in the room to come and talk to you. So well done, everybody, for joining in the chat. I love seeing those messages pop in. So we're in the high 20s now. We've got almost 27 people in the room. So I'm going to start, first of all, with some introductions. We've got some really amazing people in the room, like I said, but I'm going to get them to introduce themselves. So I'll start with myself. I'm Dr. Sally Pizarro. I'm the lead for the Midwives in Focus program that we're running at the moment. And this Nursing Now Challenge Global Solutions Initiative is what we're talking about today. And I'm really excited to get everybody together around the room and around the world to really address some of the challenges we're seeing in practice around the world. So I'm from Coventry University, and I'm going to pass on to the next person on my screen. Suzanne Wertman is here. We're very lucky to have you. Please may you just introduce yourself and say a few words about what you're about.
Thanks so much, Sally. I'm Suzanne Wertman. I'm a nurse midwife in the US. I work for our professional association, the American College of Nurse Midwives. I work with our midwife volunteers across the country in state government affairs to improve access to midwifery and improve the working environment of midwives. I'm so happy to be here. Thank you. Should I pass it on to Jude?
Great. Yeah, pass it around the room. Thanks.
Hi everyone, my name is Jude Jones and I'm a midwife based in the UK. I work for the University of Salford and I'm the project manager for Talent Groups, which is online communities of practice for nurses and midwives globally to develop their skills, as well as being involved in the Face Mums project, which is small groups of pregnant women cared for by midwives in the NHS. And shall I pass on then to Rafat?
Excellent, thanks, Jude.
Sure. Hi, I'm Rafat Jan and working at Aga Khan University. I'm a nurse midwife, and I've been working with private and public sector nurses in education, research and practice. Thank you.
Thanks, Rafat. The next person on my screen is Pandora. Pandora, would you like to say hi?
Good day and welcome to our global midwifery community. My name is Pandora Hartman and I'm here with you today as the Chief Nursing and Midwifery Officer of JPIGO, whose goal is to save and transform lives. Here with you today, believing in the power of midwifery practice.
Excellent, thank you, Pandora. And then we have Jama Egal. Would you like to just say hi?
Yes, hi everyone. Thank you so much for coming and joining us today with this beautiful, amazing initiative for midwives. My name is Jama Ali Gal. I'm a UK trained nurse midwife, and at the moment I'm the lead midwife of the midwifery department at the University of Hargeisa in Somaliland. Thank you so much.
Thanks very much. It's wonderful to have such diversity in the room and on the panel. So the reason we're all here today, I've touched on it a little bit, but I'm going to hand over to Pandora for a real recap of what this is really about in terms of our challenge to you. And we're midway through our challenge. We launched this already, but this is where we're at now, hoping to have a really productive session. Pandora, could you please be your inspiring self, please?
Thank you so much. Why are we here today? We are here because we are bringing midwifery back into focus, because we believe we can be the change that we wish to see. So we are presenting a challenge for you today, the Global Solutions Initiative. You're seeing more and more with things that used to be called like hackathons and that started in the tech industry. And now we've revamped and readapted for our industry because it's time for us to tell our stories, even as midwives, and be the changes. Why do you see these ladies? Do you know who they are? Because I believe that to know our history is to know the future when we are thinking of solutions. One, if you haven't read this book, I do say definitely read The King's Midwife. This was a French midwife who was one of the first who actually got a salary from the royals to travel around the country and do her thing. She invented a machine which transformed what was happening with women and midwifery practice. To the left side, you see Angelique. Angelique, she was another midwife who came out of Prussia. Who amongst you has used a speculum? I think that's a lot of us in the room. She was credited with a lot of what was happening with creations of the first speculums. But where are these stories in our history? Do we often think of ourselves as the solution, or is it that we often are the ones who are invested in the problems and can't see beyond the problems that we have? Rethinking what is the past. You see here on the left, that's a picture. You know, it's in one of the historical archives of Madame de Caudrey's, the King's Midwife, the French, her actual diagram, the actual model that she traveled around the country teaching OBs, and midwives with. And think about the timing. We'll rewind into the 1700s. But to her right side, some of you may recognize that too. That's Mama Berthy. Mama Berthy is part of this suite of materials from the Helping Mothers Survive modules, helping babies breathe, breathing after birth, all of those things that have been created with us in conjunction with Laerdal Health. Look at that, 400 years ago and similar solutions today. Isn't that a little bit interesting when we think about midwifery and the impact that those two ladies with all of these tools have made 400 years later? Rethinking our past because we've got to reimagine the future. Midwifery solutions, I'm showing you. Pads. Why did she put pads? Why did she put Kotex? You know why Kotex? Kotex is because disruptive revolution. In the middle of a war, World War I, World War II, Kotex came to be. Kotex, the discovery of Kotex is actually credited to nurses and physicians on the battlefield from World War II. And World War I, because the surgical nurses actually found that the cellulose cotton was more absorbent than the standard bandages that they were using. So long days, hard hours, we know about this still today. So they just packed that stuff to take care of their monthly needs. And hey, presto, add a little bit of time, add a little bit more invention and commercial, and there came Kotex. There was one point where they were even saying to help the war efforts, this is the way to do, pad yourself out. Whereas women's times used to be emotional liability, with the invention of Kotex through nursing and midwifery intervention, women were actually able to join the workforce. We got a lot in us, don't we? Because we are the future. And if we believe in our dreams, Eleanor Roosevelt, one of the longest serving first lady. She was a women's rights activist who believed in the power of women and did a lot to pull forth nursing and midwifery. But who are we? Do we believe in ourselves, or do we just believe in the lack? Think to the past, reimagine the future. This is why I believe that when we look at the ask of the Global Solutions Initiative, where as a sponsor, we're asking you to think through workforce, education, training, service delivery, leadership and governance. Think beyond, what do we want? What can we need to do? How are we going to address these challenges? How are the solutions going to improve our patient outcomes? No idea is too big or too small, and all ideas are welcome, because we know we, ladies and gentlemen, as midwives of the world, are the ones that we have been waiting for. And I can't wait to hear what ideas you all come up with as we bring midwives back into focus. Over to
Thanks,
you.
Pandora. Yeah, thanks, Pandora. That's really great. So just a little bit of inspiration there for you all. Thinking about, we're going to have to bring the solutions to the table. We can't wait for anyone else to do it for us. That's right, Pandora, isn't it? So we're asking you really to come forward with the solutions. And like I said, we're partway through this, but our deadline is the 25th of February for you to get your solutions to us. So do get involved with that. But next, I'm going to go back to Gemma Igal again, who's going to give us some insights into the experience of midwives in Somaliland and the challenges faced there, to think about how we might overcome certain things that they need to overcome over there and everywhere else. So Gemma, are you there? I hand to you.
Yes, I'm here. Just a second. Thank you so much. Let me share my screen. Okay, so we're talking about experiences of midwives in Somaliland today, and I think I'm not. Can you see the full? Yes, I hope. Okay, so this is you'll see here on the right a little map of where Somaliland is. I hope I'm sure not everyone knows where Somaliland is, and Somaliland is a post-conflict setting, and hence the pictures of the conflict and the way Somaliland is now. And midwifery in Somaliland overall is a very, very respected and prominent profession. So it's not as some countries where midwifery practice is new or needs to be established. Somaliland loves midwives. Midwives are very strong women that are very prominent. Every family, advises their daughters and girls to study midwifery and, empower other women. It's amazing how much midwives are respected, and as the women who bring life and grow their community and support women and young girls, and in every aspect of life, because it's very much understood that midwifery is not delivering babies only, but that the scope of midwifery is way larger than that. And I really, really love that aspect about Somaliland and midwives. So I'm very proud of that. But yet, of course, there's challenges still, and that's what I'm here to talk about today. So one of these are just some, and I think a lot of the things that I've chosen to mention here can be, applicable for many, many countries in the third world, or that are low resource countries. So we have a very low interprofessional working relationship that midwives have with mainly doctors and other people that they should be working with, because of the very challenging setting that we have. We need a lot of when you talk about saving mothers' lives, we need to work in teams, we need to work in partnerships, we need to work interprofessionally with other professions and be supported in what we all try to achieve, which is a healthy mother and baby. And that seems to be very low. Some of it is sometimes people say that it's jealousy of the practice of midwives and trying to minimize or the scope of the midwives. And other professionals see that or view that midwives are taken on some of or are better at their jobs than they seem to be. And women love to deliver with midwives and within the midwifery practice and avoid interventions using midwives. So another thing is that midwives have low access to continuous professional development. And this, for newly qualified midwives, is a huge problem because they do understand that they need this, but they don't have the access to it. And since we know that midwifery practice is changing, always changing, and there's so much to learn, they're very eager to learn, but there's no access to continuous professional development after qualifying. There's a lack of registration with the professional body and our professional association. And that is also to do with the understanding of the importance of being registered, being after qualification. And this also is linked to the fact that management is not requiring this as much. So it's also a managerial issue within the clinical practice of midwives. There's lack of research for midwives, by midwives. Although there's a lot of data, there's a lot of beautiful information to be had from Somaliland, yet there's a lack of research, which also links in again to evidence-based practice from a context-specific point of view. There's low and unreliable pay for midwives, which causes a low morale, which we all, like it's an ongoing problem everywhere, but we're on another level, lower level of that. So this causes low morale for midwives and causes challenges for them to continue working, the long hours, the long shifts, a lot of things that they're doing that are unpaid actually. So there's also no support in interview and CV applications, for job applications. So this again causes or is not helpful for midwives in aiming to go for higher jobs and managerial jobs and things that they could be doing in leadership positions all over the country. They have the access, it's not, and they have the education. It's just the connecting to these interviews and jobs is a little bit difficult, which causes a challenge for them to acquire higher jobs, higher level leadership management positions. There's lack of role models in higher positions that give back information and connect back to midwives. So midwives are working within all different leadership positions in Somaliland, whether it's ministry level or universities, NGOs, local NGOs, INGOs, or international NGOs. But it's there's very little connection between those and the midwives who are working in the clinical settings, whether senior positions or junior positions. And so midwives always say, I wish I knew more about the midwife in charge of our association, for example, and who's working in the association, who's working in, we have NHPC, National Health Professionals Commission, that registered midwives, but we don't know who's working there. So there's that link missing. That would have been helpful for midwives all over. And also there's very few opportunities for quality improvement in midwifery clinical settings, because those are the things that doctors do. doctors improve quality by doing research and then changing what needs to be changed. So it's a little bit challenging for them to actually see also that they could be doing that. They don't need to wait for nobody else, like Pandora said, which we don't need to do all over. So to improve the quality in the clinical settings. And this again is demoralizing for midwives, because they know what needs to be done. They have the capacity to do it. It's just that somehow they don't. And then that, you know, gives them the idea of, or the feeling of, why am I going back again and again and again in a working in an environment or situation that I know I shouldn't be working in. I should be able to do more for my women, for the mothers that I interact with. And so I always tell them, and we have a lot of initiatives now with that and working in Somaliland, I think, that are amazing for midwives, giving them the opportunity to do more and get more training. So today, what I have a few suggestions here, but the reason we're here today together is to come up with more and to also link with you guys that are with us today, to see what everybody else, you know, what else you guys can come up with and help us with. So we need to, I would say, listen to each other and uplift midwives every time we can. This is a responsibility of all of us, that we have to do this everywhere we are, wherever we live. I think it's very important for us to uplift ourselves, come up with ways to help each other, and support midwives in what they're doing, whatever it is, whatever issue they're dealing with at that moment. I think a lot can come from that, supporting each other whenever we can. We need a focus on research and evidence-based practice. I'm a PhD student. I do a lot of research in Somaliland at the moment, and there's so much coming out. It's amazing how much we can push agendas forward for midwives when we have evidence that can support us in writing proposals, but also coming up with real reasons, trying to understand why women are doing what they're doing, why midwives are doing certain things, what need to change, even within our guidelines and things like that. So we need training on leadership and quality improvement that is context specific. Again, we need to ensure information sharing with health professionals, but also our women. We do a lot of things, but we don't, or midwives in Somaliland at least, we're so busy that we just don't give the women the information that we could have given them. And which also, again, would support them in trusting the midwives in knowledge-wise and also experience. So we need to support midwives in their professional development, again, everywhere. So it's not just, for example, I work at the university, and what we do is help undergraduates, but then they become midwives and then that's it. So we need to support them in their professional development and come up with strategic and pragmatic ways for them to understand that there's thousands of things that they could do with their midwifery profession and all the knowledge that they have. And again, there's no one coming to fix our challenges, only we can do it. That's, I think, the message of today. And I hope that I know we're going to come up with a lot of good information. Thank you for listening. Thank you, guys.
Thanks so much, Shima. I think the message is clear in terms of, we need to do it ourselves, which is why this challenge is here and why we've set this challenge. So that you as midwives yourself can think about the solutions we need, and also then take that forward to make dreams a reality, turn visions into practice, basically. And before we move on, I just want to go back to the chat. I know you've probably all been following, but all of the details about the challenge and how to submit your ideas to the challenge are there. So we've got the website address, the email address. There's a $500 prize, I believe, and you'll get mentorship from really kind of inspiring midwives in the field, along with becoming part of our steering committee. So we're really looking for those midwives who have real innovative solutions to come and join us on the Midwives in Focus steering group, get personalized coaching with us and really help us shape the future of what we do in this program. So before we go any further, let's just go back in the chat and make sure we're aware of that. But going forward, we're hoping this session today will help you to shape your ideas, take them forward, you know, turn the talking into doing, basically. So we now need to go into a different room where there's going to be a link put in the chat almost imminently, and we'll be going there. So please follow the link that's being put in the chat now. We'll go over there, we'll join you over there, and that's where we'll go into breakout rooms to support your ideas going forward. And we can really kind of, I look forward to listening to some of your ideas and how we can shape them. So I'll see you in the next session just now by clicking the link in the chat right now.